When anxiety really surges, it can feel like all the signals in your brain are just cranked up to 11, way too loud. Well, Alprazolam is a medication that's literally designed to turn that volume way down. But here's the thing, a tool this powerful for bringing release, it comes with an equally powerful set of rules. So let's dive right in and unpack this. And really, that's the whole story right there. It's all about balance. On one side, you've got this incredible relief from anxiety and panic. But on the other side, you've got a really strict set of safety rules and serious risks that you absolutely have to respect. It's all about understanding both sides of that coin. So here's how we're going to break it all down in this explainer. First, we'll talk about the promise of calm, then the everyday trade-offs. After that, we'll hit the critical safety warnings, the risk of dependence, and finally, we'll wrap up with safe use and some FAQs. All right, let's kick things off with part 1, the promise of calm. We're going to look at what this medication actually is and how it works inside your brain to quiet all that noise. So first things first, Alprazolam is part of a class of medications called benzodiazepines, or benzos for short. You can pretty much think of them as, well, helpers for your central nervous system. Their whole job is to create a calming effect. And what's really important to know right from the start is that they're usually meant for short-term help with anxiety and panic. So how does it actually pull off that calming effect? It's pretty fascinating, actually. Alprazolam works by boosting the effects of a natural chemical in your brain called GABA. Now, GABA is basically your brain's main calming messenger. So by giving GABA a little superpower boost, the medication tells your nerves to chill out and fire less often. It's literally turning down the volume on all those overwhelming brain signals. But turning down that volume doesn't come for free. And that brings us to part 2, the everyday trade-offs. Let's talk about the common side effects that can come along for the ride. And it kind of makes sense, right? Since the medication is slowing things down in your brain, it's pretty common to feel things like sleepiness, maybe some dizziness, you might notice your thinking is a little slower, or even have some memory issues. These are pretty much the most common trade-offs for that calming effect. Okay, and this leads to probably the most important practical piece of advice here. Because it can make you sleepy and dizzy, you absolutely, positively should not drive or use any kind of heavy machinery until you know exactly how this medication affects you. Seriously, safety first on this one. Okay, so now we're moving into part 3, and this is where things get really serious. We're talking about the critical safety warnings. These are the absolute non-negotiable rules for using this medication safely. And that brings us to a question that everyone, and I mean everyone, needs to know the answer to. What are the most dangerous things to combine with Alprazolam? And listen, the answer here is crystal clear. You should never combine it with opioids, unless a clinician is specifically telling you to and is watching you very, very closely. The exact same rule applies to alcohol and any other central nervous system depressants. I'm not exaggerating when I say these combinations can be fatal. Let me put this as simply as I possibly can. The reason this gets the official boxed warning, the most serious one there is because of this simple, terrifying equation. Opioids plus benzos can equal dangerously slowed breathing, and that can lead to a coma or even death. It's a formula you just have to burn into your memory. And the danger list doesn't actually stop there. There are other interactions to watch out for. For instance, strong CYP3A4 inhibitors. Okay, that sounds technical, I know, but drugs like the antifungal ketoconazole are a big no-no. They basically block the tool your body uses to break down Alprazolam, which means it can build up to dangerous levels. And believe it or not, even grapefruit can do something similar. This is exactly why it is so important to give your clinician a complete list of every single thing you take. All right, next up, part 4, the risk of dependence. And this is a really big topic. We need to talk about what can happen if you use it long-term and, just as important, how to safely stop taking it when it's time. So picture this. You've been taking it for a while and you feel like you're ready to stop. The big question is, can you just quit cold turkey? The answer to that is a hard, absolute no. You should never, ever stop suddenly. The withdrawal can be incredibly severe. We're talking dangerous, potentially even causing seizures. If you take away one thing about stopping this medication, let it be this. Now, the good news is there is a safe way to do it. The right exit strategy has 3 simple steps. 1, talk to your clinician. 2, work together to create a slow, gradual tapering plan. And 3, pay close attention to how you're feeling throughout that whole process. That is the only safe way to come off this medication. All right, we're heading into the home stretch with our final section, Part 5, Safe Use and FAQs. We're going to quickly cover some folks who need to be extra careful and then hit a few common questions. So, who needs to take extra precautions? Well, older adults, for one. They can be way more sensitive to the side effects, which means a higher risk of falls and confusion. Also, anyone who is pregnant or breastfeeding really needs to have a serious talk with their doctor. And here's one for literally everyone. Always keep this medication locked up and away from other people.
Okay, first question in our quick fire round. Is it addictive?
The short answer is yes. It definitely carries real risks of abuse and physical dependence. Now, that doesn't mean everyone who takes it will become addicted, but the potential is absolutely there, and you have to respect that risk right from the very beginning. All right, next question. Is it okay to use for several months? For the most part, no. This medicine is really designed for short-term use. If there's any thought of using it long-term, that's a conversation that needs a very careful and continuous review with a clinician, just to make sure the benefits are still outweighing the very real risks of dependence. So, when you boil it all down, what's the big takeaway? Alprazolam is an incredibly powerful calmer, but it's one that demands an equally powerful amount of care and respect. It really makes you think, doesn't it? How do we best use these tools that can give people so much relief while never ever losing sight of the risks that come with them? And just one last thing before we go. Please remember, this explainer is just for learning and informational purposes. It is absolutely not medical advice. For any questions about your health, you should always talk to a qualified healthcare provider.